Hey guys, it's Dr. Cheri here at HealthFit. We're going to talk about hip and knee dominant squat. So a lot of times if you're squatting and you're not aware of your positioning, you might experience some hip discomfort or some knee discomfort when you're squatting. And so if you're able to film yourself or have someone watch while you're squatting, you can kind of tell, are you doing a knee dominant strategy or a hip dominant strategy? And there's no right or wrong in terms of which one is better for you, but if you are experiencing hip discomfort or pain, maybe transitioning over to a more knee dominant strategy could be beneficial in the short term. Or vice versa, if you're experiencing some knee discomfort or knee pain while you're squatting, potentially switching to a hip dominant strategy could be beneficial. And so the main differences is just where the load is through your body. So a knee dominant strategy is targeting a lot of your quadricep muscles, which is the front of your thigh, whereas the hip dominant strategy is more of your hip muscles, your gluteal muscles, hamstrings, basically the posterior chain. And so if you film yourself, for example, knee dominant strategy, again, more of the quads. So if you're holding a weight, those knees are coming more forward. So you're feeling a lot of tension in the quadriceps here. Hip dominant strategy is you're gonna feel a lot of the posterior chain where you're sitting back more, loading here versus the quads. Again, there's no right or wrong. It's just a matter of what you're feeling when you're squatting. Sometimes it's individually preferenced. Other times it's actually the length of your femur, which is your thigh bone. A lot of times when people have shorter thighs, they actually become more knee dominant because of the leverage and how that changes. Again, there's no right or wrong, just whatever's preference for you and what you prefer. Again, if you're experiencing discomfort or pain, please reach out to your healthcare provider, as well as film yourself when you're squatting and see which dominant strategy are you using. And if you tweak it a little bit, does that change your symptoms? And if you're trying to learn to change your strategy or become more hip dominant, what you can do is get a chair or like a raised surface and think about whatever your squat position is. Think about sitting your hips back towards a chair. That way you're loading more here. And you have a cue and a feedback to tell you if you're hitting that versus if you're here and you're not finding the chair is going to help you sit back more.